Assalamualaikum warahmatullahi wabarakatuh and good day everyone. My name is Sharifah Aidanabilah binti Syed Azmi. I am a student at University Sultan Zainal Abidin in Bachelor Degree of Nutrition Science and in Semester A. Today I want to present to all of you about my case study during my internship at Klinik Kesihatan Kuala Berang, which is anemia in pregnant women. My industrial supervisor is Puan Nurul Aida, while my academic supervisor is Dr. Vivi Swet. Okay, during pregnancy, the body needs double the amount of iron that non-pregnant women need. Anemia during pregnancy is considered severe when hemoglobin concentration is less than 7 gram per dl, moderate when it is between 7 and 9.9 gram per dl, and mild when it is 10 until 11 gram per dl. For the social demography or social history, Mrs. M is 24 years old Malay woman and is working. She stays at Kuala Berang, Terengganu and comes from moderate economic status. His level of education is high school and it is her first pregnancy. She started to be diagnosed with anemia at 12 weeks of pregnancy, which is late of first trimester with hemoglobin of 10.5 gram per dl. For the medical diagnosis, her body temperature was normal, no cough and no fever. Her physical examination was normal and good, no palpitation, she had a good appetite and normal bowel movement. For the diet diagnosis relation, the patient was advised to avoid caffeine source foods or drinks such as coffee or tea that inhibits the iron absorption process. The patient was advised to eat more vitamin C rich food since it can enhance the iron absorption. Patients was also advised to eat a balanced diet and consume more iron-rich food. For the medication or drugs, she was prescribed with zinc copper and iodized salts on the early pregnancy, which is before she became anemic, and then prescribed with zinc copper and ferrous fumarate later after being diagnosed with anemia, and then prescribed with hematinic, which consists of ferrous fumarate, vitamin C, B complex, and folic acid due to the constant change in HB level during his second trimester. And then she received interferon injection in 3 consecutive days with 4 ml each due to the constant change in HB level on his third trimester. However, the patient's compliance to all of the medications given. For the nutrition assessment and interpretation, as we can see, her booking height is 158 cm, booking weight 43.6 kg, and the booking BMI is 17.47 kg per meter square, which is considered underweight. However, she has an ideal weight gain during pregnancy, which is 18.4 kg, and it is still under acceptable range. Okay, so here is the biochemistry data along his pregnancy journey. As we can see, during her first trimester, her HP level dropped to 10.5 gram per dl at his 12 weeks of pregnancy, then followed during his second trimester and third trimester. Due to the constant change of HB level, she received interferon injection on 3 consecutive days with 4 ml each injection. So here is the clinical data. She has a normal blood pressure along the pregnancy journey. So for the dietary related history, the patients met with PSP on his 29 week, which is in his third trimester. The PSP collect his 24 hours diet recall, and as we can see here, she had breakfast which is fried rice, plain water, ferrous fumarate, morning tea, donut, kueh cekmek and milk, lunch, white rice, fried fish, ulam and plain water, afternoon tea, curry puff and keropok leko, dinner, white rice and fried egg, supper, cocoa crunch with milk and ferrous fumarate. The estimation calorie for his dietary intake is 1,722 kcal per day. The patient consumed enough portions of carbohydrates, proteins and fat in daily meal except vegetables and fruits. The patients also did not eat enough iron-rich foods but compliance to all of the tablet irons. Nutrition diagnosis and intervention. Anemia is related to inadequate mineral intake of iron as evidenced by the hemoglobin of 10.5 gram per dl at the first trimester of pregnancy. The objective is to raise the HB level to the normal level, which is greater than 11 gram per DL, and maintain it until labor. The principle is to gradually increase the HB level by increasing intake of high iron-rich foods. The patient also needs to eat more heme iron foods rather than non-heme iron, which is a plant-based. The patients also need to increase the intake of fiber through consuming enough portions of fruits and vegetables, at least 3 servings of vegetables and 2 servings of fruits per day. Vitamin C-rich foods enhance the absorption of iron efficiently. Compliance to all of the iron tablets given, and eat the medicine at the right time of the day or it might not work. So the overall plan is to encourage fluid intake, high fiber diet, iron-rich foods, and vitamin C-rich foods. So for the nutrition diagnosis and intervention, here is the general suggestion for estimated energy requirement. As we can see, it was a different for each trimester. This is the general suggestion for estimated macronutrient requirement, which is carbohydrates, fats, and protein. For the nutrition monitoring and evaluation, we need to make sure that the patient will achieve the normal HB level before labor to prevent preterm delivery, low birth weight baby, and even death. We need to make sure that the patient eat a balanced, healthy diet and follow the recommended energy intake per day, eat variety, and consume iron-rich foods. She also need to consume plain water at least 6 to 8 glasses per day. Avoid the iron absorption inhibitors foods such as tea, coffee, cocoa, milk and dairy products, calcium, yolks, tofu, oats, and whole grains. Compliance to all of the tablets, irons given, biochemical data and anthropometry follow-up will be done continuously to monitor increment in body weight and HB level. The mother also need to complete the breastfeeding lesson before their 28 weeks of pregnancy at the health clinic. The mothers also recover from anemia at 35 weeks of pregnancy with HB of 11.3 gram per DL, and the mothers then give birth to a baby girl at her 38 weeks and 6 days. So here is the postnatal follow-up. The baby girl is healthy with a weight of 3.18 kg, length of 52 cm, and head circumference of 32 cm, which is normal. However, the baby are admitted to an ICU because of the Thompson and Salivati score, the hypoxic ischemic encephalopathy score. Thompson and Salivati score is a clinical tool comprising of a set of clinical signs associated with central nervous system dysfunction. The baby and the mothers was discharged from hospital after 2 days and both were in a healthy condition. So for the discussion, Millman 2014 says iron demands in pregnancy cannot be fulfilled by dietary iron intake but require oral iron supplementation. Asri 2011 says administrations of iron tablets and supplements in health facility helps to reduce anemia during pregnancy. Itscare 2000 says that beverage that contains polyphenols or tannins such as coffee and tea may make it harder for the body to absorb iron. The effect may be lessened by having this beverage between meals instead of with them. The patients follow the advice given to eat a balanced, healthy diet and follow the recommended energy intake per day, eat variety, and consume iron-rich foods. Next, Grace 7 2018 says that education has been reported to reduce the risk of being anemic in several studies. Educated pregnant women have better income and eat nutritious food and hence do not get nutritional anemia. Furthermore, with the weekly biochemical data and anthropometry follow-up at the nearest health clinic, it helps to improve mothers' health status. So for the conclusion, in Malaysia and in many other countries in Southeast Asia, anemia in pregnant women constitute a major health problem. The negative consequences of anemia impair quality of life for both mothers and newborn babies. Alta 2012. Since Mrs. M gave birth to her baby when her HB levels were normal, the baby was healthy without any problems. Modifying the diet can affect other areas of life and other aspects of health. Eating more iron-rich foods or limiting foods that can inhibit iron absorption are two strategies that play an important role in treating anemia. Anemia contributes to perinatal complications. postpartum anemia, increased maternal perinatal mortality, as well as prematurity and low birth weight of the newborns. Ongoing interventions to target anemia during pregnancy seems to be working in this setting. In conclusion, by making healthy lifestyle choices, including a nutritious, iron-rich diet, it can help to prevent anemia. So here is the reference. Thank you.